Hey guys, in this video we are talking about the kettlebell, Psoas, and Iliacus release, or deep hip flexors. This one's a gnarly one, but it's actually super effective. The best way to kind of achieve this mobility is to use the handle of a kettlebell. The shape of it is actually kind of a perfect shape to run along the inside line of your pelvis so that you can reach kind of the broad spectrum of where these muscles attach. The Psoas and the Iliacus both cross this hip, front part of the hip joint here. With our society these days, we spend a lot of time sitting, whether it be in the car or at a desk. And so these muscles often become tight and shortened. Even if they're not shortened, sometimes they're just turned on a lot and all the time and just not getting a rest. And so they become really irritated. They can cause problems with hip pain, problems with back pain. So this is actually a really effective release and can help actually fight that tug of war that happens with the Psoas and the QL that's kind of opposite to it in the back. I like to use a bit of a smaller kettlebell. I know there's some really big ones with the larger handles. Depending on your body size and shape and the size of your torso, that might be more appropriate. But for me, this kind of medium to smaller size works pretty well. I'm going to today work my right side, so over here. So I'm actually going to turn this kettlebell kind of on an angle so that as I lay on it, it's actually going to kind of fit the pattern of the front part of my pelvis here. So all you're going to do really, I want to back it up just a little bit. So that kettlebell's kind of turned on an angle, right? And I'm going to kind of lie myself down right over top. You have to be real careful and have some good support in your upper body to make sure that you don't really jam this into your gut, because that's not the point of this. You don't want it to be and give you right in the belly, right by your belly button. This needs to sit. If you're actually going to have it sit kind of right, if this is my pelvis, right, this is my pelvis bone kind of right through here, it's going to be just to the inside of that. So it's actually going to sit kind of right like this, okay? Now the Iliacus runs on the inside of the bowl that is the pelvis. So it literally runs along the inside of the bowl there. The Psoas is to the inside of that. It's kind of deep, like underneath your abdominals there. So that one's a little bit trickier to get to, but we'll talk about it as we go. Now, I'm actually going to turn my whole system here. So again, this is still on a bit of an angle, but I'm going to turn my body on an angle so you can see what I'm doing. Okay, so here, I'm going to lie myself down right on top of it. That leg that I'm working is going to go a little bit straight, and I'm really controlling it with my upper body, so I'm not just leaning, plopping my whole body weight down onto it. Okay, if you can kind of see, my other leg is just kind of bent out to the side here to kind of help support my body weight. All right, so now here we are. It is laying just to the inside of my pelvis bone, just on the inside of the bowl of the pelvis. I am picking up a lot of the slack with my arms here, right? So that I'm not putting full body weight on it. It takes a little bit of practice to engage, or to figure out how much weight to put on there, because again, this is not going to be comfortable at first. But I'm going to start by putting that edge as close to my pelvis bone as I can, and almost kind of tilting my hips so that it's kind of pressing to the inside of that bowl that is the pelvis, right? I want to try and hit the outer edge of that iliacus muscle. Once you're there and you kind of hang out for a little bit, you might, kind of feel some sticky spots. You can bend your knee and extend your knee back and forth like this. You might feel that kind of muscle move a little bit underneath. You can rock your foot side to side to get your hip to rotate a little bit, right? You can even kind of dig your knee, like push your knee down into the floor a little bit and then relax. You can even lift it up off and go up onto your toes, right? Just some things that you can do to kind of work that muscle underneath. And then just taking some big deep breaths. As you breathe in, you want to push your belly kind of out into that handle. And then as you release it, try and sink a little bit further into it. Sometimes I'll even take that same side arm and reach it up, kind of up over my head. I'll often feel this stretch quite a bit more when I do that. This is one of those that you kind of just have to go to your happy place and take some good deep breaths. Try and relax into it as much as you can. Good. Now to come out, I want you to be very careful. I want you to really kind of gently engage your abdomen and kind of push your belly muscles out into that handle a little bit as you slowly come up out of it. You don't want to do this rushed or quickly. You don't want to hurt your back. Now to reach the psoas, you're actually going to shift a little bit so that handle is actually a little bit more towards the inside. It's in between your belly button and your pelvis, right? Again, not directly on your belly, like, you know, the middle of your belly, not directly on your stomach or of any kind, anything like that. But that psoas is gonna run just medial or just to the inside of the iliacus. And then you go through the same process, really. So bending the leg up and extending it. This isn't actually moving those hip flexor muscles because those hip flexor muscles cross the hip joint alone. So the knee itself isn't going to affect it, but just by getting some, it kind of changes the pressure on the handle there. So you can go back and forth a little bit, right? You can go up onto your toes to take that knee off and put a little bit more pressure on and back. Again, just breathing into it. As you breathe out, you release a little deeper into that stretch, or into the handle. Good. And then again, to get out, I want you to be real careful. Gently get your elbows up underneath you. Gently contract those abdominal muscles, squeeze your tush, kind of push your belly muscles out into that handle as you slowly sit yourself up. All right, give that one a try. Spend a couple of minutes on both sides and let us know how it goes.